Why is the forehead spared in UMN type of facial nerve palsy? The concept behind this is a bit confusing, but it's really important to know the reason behind it. The facial nerve nucleus has two parts, the upper part which supplies the upper half of the face and the lower part which supplies the lower half of the face. The upper half of the nuclei has bilateral representation, which means it receives fibers from the ipsilateral as well as the contralateral cortex, whereas the lower half of the nuclei receives only fiber from the contralateral side and not from the ipsilateral cortex. For an example, let's look at left side UMN type of lesion as in this image. Here, the fibers to the left upper half of the nuclei are damaged, but it retains its function due to the innervation from the contralateral side cortex, whereas the right lower half of the nuclei has lost its only supply from the contralateral cortex and the patient presents with contralateral lower half facial weakness with forehead sparing. Looking at element type of lesion on the right side as in this image, the fibers are damaged only after arising from the nuclei. Hence, both the fibers supplying the upper as well as the lower half of the face are damaged, and hence the patient presents with ipsilateral full side facial weakness. Remember, UMN lesion, there is bilateral representation and contralateral side lower half facial weakness. And in element type of lesion, fibers arising from the nuclei are damaged and the patient presents with ipsilateral side facial weakness.